So the foundation of any immunization strategy is information. Information about populations requiring vaccination, vaccine commodity information, information about vaccine delivery sites and the healthcare workers trained to deliver those vaccines, information on the safety of different vaccines, and information on what vaccines have been approved for delivery in a specific country. Now, in the case for COVID-19, the information needs, and hence the information system requirements, are so much more expansive and complex than we've ever dealt with before. We've never attempted to vaccinate the entire world before. So digging in a little bit, I see two overlapping buckets of information. One for prioritizing populations in need of vaccination, considering the limited supplies of vaccines that will be available to countries. And the second for deployment. That means getting vaccines into people's arms in a phased manner as efficiently as possible to reduce the burden of the epidemic on a given country. So at a global level, a lot of work was done early in the pandemic to identify populations most at risk. And at this point, most countries have adopted a population prioritization framework, most building upon the WHO population prioritization framework. However, deployment of these vaccines requires much more nuanced information, built on granular information at the subnational unit, including an understanding of risk and population size, as well as infrastructure and healthcare worker capacity issues. At Palladium, we are supporting countries to think through their COVID-19 information system requirements and information needs more generally, and helping countries bring these multiple sources of data together that I mentioned and triangulate them to ensure continuous quality improvement in both the COVID response and vaccine delivery. Broadly, we are supporting best practices in system governance, subsystem development, data exchange and interoperability, as well as analytics for decision-making. On the USAID-funded Data.FI project, we are supporting countries to use existing information for COVID-19 response planning and vaccination rollout. We had developed an epidemic control room model intervention to support the use of information at the subnational level in Nigeria for HIV. We then scaled this to West Africa, adapting it to the HIV context there. With the advent of COVID, we adapted this approach further and changed our epidemic control room model into an emergency operations center model, bringing stakeholders together using similar methodology of data triangulation and data display electronically to support advanced decision-making. We then worked with stakeholders to action plan based on the data and then follow up to make sure that the results were actually put into place or the action plans were actually realized. If we want these systems to persist and become the foundation for a future pandemic response or responses, they also need to be enhanced thoughtfully and quickly to ensure sustainability and flexibility to changing needs.